Okay. So thank you for joining me today for our second webinar on complementary medicine. So as I mentioned, my name is Jess. I'm Health Promotion Manager at Arthritis Queensland. And today's webinar is about complementary medicine. So we'll be focusing on a few different types of complementary medicines and their effectiveness in helping to reduce some arthritis symptoms. I think we'll sort of touch on it multiple times throughout, but really a key takeaway whenever considering the use of complementary medicines in supporting your arthritis management is always to speak with your GP or pharmacist when starting anything new. But like I mentioned, we'll definitely go further through that. So first of all, just it's important to mention that this presentation contains general information and advice. So every effort has been made to ensure that the information is accurate and reliable. And the content of this presentation is not a substitute for individual treatment and the advice of your doctor or health professional. So always consult your doctor or healthcare provider to obtain individual medical or treatment advice. And in the spirit of reconciliation, Arthritis Queensland and New South Wales acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So just a little overview of what we will go through in today's presentation. So we'll be touching a little bit on what complementary medicines are, their potential problems and how they're regulated in Australia. We'll touch on a few different specific complementary medicines, so including fish oils, glucosamine, chondroitin, turmeric and rosehip. And we'll have a little bit of information around their effectiveness and safety based on an Arthritis Research UK report and some more recent research as well. And then some things to consider so that complementary medicines are used safely. So first of all, complementary and alternative medicine. So sometimes the CAMS sort of little abbreviation is used. So complementary medicines are a group of diverse medical and healthcare systems and practices along with products that are not generally considered part of conventional medicine. Complementary medicines may also be called sometimes traditional or alternative medicines. You've probably heard them referred to as well. So this is in comparison to what's often called Western medicine, which is a system in which medical doctors and other healthcare professionals, so like your nurses, pharmacists and therapists, treat symptoms and diseases using drugs, radiation or surgery. And this is also then referred to sometimes as conventional medicine or mainstream medicine. As adding to that as well, some conventional medical care practitioners are also practitioners of complementary or alternative medicines, or may use them as part of their normal recommendations and treatment. So for example, recommending therapies like Tai Chi exercise for those with osteoarthritis. Just checking if there's anything else to mention here. So overall, although most complementary medicines are thought to be safe and some is evidence-based, generally the concern around the use of complementary medicines include that there is a lack of reliable information and issues regarding their regulation. So often you may have sort of found, if you have mentioned to your health team before, sometimes health professionals are a little reluctant or may feel ill-equipped to deal with questions from patients around complementary therapies and their use and their effectiveness. And they may frequently be cautious about recommending complementary therapies. And I guess that's sort of why complementary therapies sort of tend to sit within this group, because they sort of don't have that thorough research behind them at this stage to support their widespread recommendation or use within Western medicine. So like we sort of discussed, complementary medicines often sit outside mainstream treatment. So here we've sort of got the key sort of the mainstream treatments and the different categories on the left, with the complementary therapy sitting outside of that. But more and more often people are starting to turn to alternative medicine, and not as necessarily a replacement to those Western medicine treatments, but often as sort of to go alongside those treatments as well. Overall, there is a wide variety of treatments available, and these can range from herbal supplements to practitioner-based therapies, and not all are supported or guided by scientific methods. So like I mentioned, we'll go through a few more of those in today's presentation, but there is so many different options available that we'd just never be able to fully touch on and go through in a presentation. And so it's always important to sort of for specific advice, check back with your healthcare team to really get that sort of updated information on the existing research and the suitability for you. So complementary medicines encompass a broad range of therapies, and they're often categorized in different ways. So one category which we've not shown here is more around the mind and body therapies. So this can include things like meditation, yoga, and Tai Chi, and these topics were touched on in our last webinar. So if you weren't able to join in that one and are interested in finding out more, we do have the recordings available on the website that you can listen to. We then have sort of these two other categories, so biologically based practices. So this can include dietary supplements, vitamins, minerals, herbs, and spices. And then we've got whole medical systems, often referred to as alternative medicine. So this can include things like traditional Chinese medicine, and naturopathic and homeopathic medicines. So a lot of the information in this webinar has been drawn from an Arthritis Research UK report, which was done around a wide range of different complementary and alternative medicines and therapies used for arthritis and musculoskeletal conditions. And they went through evaluating the effectiveness and safety of various therapies. And we've also got some more updated research that we've based this presentation on as well. So we will go through, like I mentioned, some of those key therapies. So the report assesses effectiveness of various therapies, and it's based on elements such as improvement in pain and function, and increased movement and improved general well-being. So it ranges, different therapies are given a score of between 1 to 5, with 1 being the lowest and indicating there's no evidence or little evidence, and 5 indicating several studies have shown complementary therapy is effective for managing various aspects of symptoms of arthritis. But overall, just the main takeaway is, as we know, arthritis is an individual disease, and what works well for one person may not necessarily work for someone else. So as well as effectiveness, the report that we have used sort of to support this presentation also goes through the safety. So we've got effectiveness for arthritis is one aspect, but of course the other aspect is around the safety for their use. So it uses a traffic light system, so red indicating serious side effects, amber indicating side effects that are serious and more common, and a green traffic light indicates mainly minor side effects and for most people generally safe. So onto the first supplement that we're going to have a chat about today is fish oils. So fish oils are oils found in the tissues of oily fish, such as sardines, salmon, and mackerel, and they're rich in omega-3 fatty acids. So certain types of omega-3 fats can reduce inflammation from arthritis, and this may help to relieve joint pain and stiffness in a similar way to how some anti-inflammatory drugs and medications also work. So omega-3 fats are also found in other foods, so certain nuts, seeds, and oils. And of course, including a range of these foods in our diet has many health benefits beyond arthritis as well. But most people are unlikely to get enough omega-3 fats from their diet alone to reduce inflammation. So this is where fish oil supplements tend to come in. It is important to not confuse fish oils with fish liver oils. So fish liver oils are those derived from pressing the cooked liver of shark or cod. And fish liver oils also contain they're rich sources of vitamin A and vitamin D. So the issue here is that large amounts of vitamin A can cause serious side effects, particularly, for example, during pregnancy. So if you take fish liver oils in the doses recommended for arthritis, you may exceed the recommended daily intake of vitamin A. So always only take the dose of fish liver oil recommended on the label. And to increase your intake of omega-3 fats, you should do so with sort of regular fish oils rather than fish liver oils. So on omega-3 fats and arthritis. So omega-3 fats have not been studied in all forms of arthritis. However, current research suggests that omega-3 fats are helpful for people with inflammatory arthritis. So this is specifically for rheumatoid arthritis, ankylosing spondylitis, and psoriatic arthritis. There is some limited evidence that fish oils may help with symptoms of osteoarthritis. But it is, quite limited at this stage. On fish oils as well, obviously it can have potential benefits for arthritis, but beyond that, fish oils also have a lot of benefits for our general health and for our heart health as well. In terms of supplements, omega-3 fish oil supplements are available as capsules or in liquid form, and different brands of capsules vary in the amount of omega-3 fats they contain. So it's worthwhile comparing brands and also speaking with your pharmacist for more information and help with determining the differences between brands and dosages. Your pharmacist as well as your doctor can provide more information about suitable dosages for you and your type of arthritis. So fish oil and rheumatoid arthritis. So there is good evidence that fish oil can help reduce pain, morning stiffness, fatigue, swollen joints, and use of painkillers. The dosage generally used in the existing research is around 2.7 grams of omega-3 daily to help with managing those symptoms. The evidence for, I guess, the benefits of fish oils and rheumatoid arthritis does differ depending on the type of fish oil. And specifically with the fish liver oils that we mentioned, there's not enough research on fish liver oils for rheumatoid arthritis, but normal fish oils, there is some good consistent evidence for its use in rheumatoid arthritis. As we mentioned, the different brands vary in the amount of omega-3 fats, and it also differs between the capsules and the oils. So as sort of shown on the slide, so a reminder to always sort of compare the different brands and speak with your pharmacist or your GP for recommendations around dosages for the brand that you may be going with. So fish oil and osteoarthritis. So there is some limited evidence that fish oils may help to manage symptoms of osteoarthritis, and this is actually in smaller dosages than that in rheumatoid arthritis. you may need to take fish oil supplements regularly at the recommended arthritis dose for 2 to 3 months before you notice improvements in your arthritis symptoms. Fish oil, I guess the safety for its use. So they're generally well tolerated and generally safe for many people. However, possible side effects can include sort of gastrointestinal effects. So a mildly upset stomach, heartburn, nausea, diarrhea. As we noted, there is the caution with fish liver oils and the side effects of vitamin A, which can include liver toxicity and hair loss. It is also recommended that you consult with your doctor before having any major surgery, or if you're commencing fish oils while taking medications like warfarin. So there is sort of some interaction that can cause increased risks of bleeding. Also, just a note here on krill oils, which is another common one that people often may be suggested from friends and family to try krill oils to help with their arthritis. So krill oil is also a rich source of omega-3, and it is absorbed much better than standard fish oil products. So that can mean fewer capsules are needed. However, when we look at the research, specifically research on krill oil use and arthritis is limited. So there isn't sort of much to say at this stage whether it is effective for arthritis. And a lot of the research around omega-3s and arthritis has come from those fish oil studies. So the exact dosages that may be needed of krill oil is not quite clear at this stage. So moving on to glucosamine. So glucosamine is a component found naturally in the body, and it's a building block of joints and tendons, ligaments, cartilage, and synovial fluid. So glucosamine supplements are usually made from shells of crab, lobster, or prawns. However, there are some plant-based forms available as well. Generally, it's previously been believed that glucosamine may help to stop or slow cartilage breakdown. However, the research up until now has always been very mixed, and many of the studies have looked only at osteoarthritis in specific joints. There was a recent research done a couple of years ago, which reviewed sort of the existing available evidence, and it really found that the existing research around glucosamine and arthritis was low quality and unreliable. So some studies have suggested that it may not be any more effective than placebos at managing arthritis symptoms or slowing the degeneration often caused in arthritis. With that being said, glucosamine is generally considered safe for most people to try, but there are specific exceptions. So that includes, of course, people with shellfish allergy, people again taking blood thinning medications, as there is some drug interactions which increase risk of bleeding. Also people who have diabetes, and this is because glucosamine is a type of sugar. And those who are pregnant or breastfeeding, and really because there is limited studies that have been done around the safety of taking glucosamine during this time. So depending on your situation, your doctor might still suggest trying glucosamine, or if you're wanting to try it, definitely talk to your doctor or pharmacist about whether it's right and safe for you. And for more information around specific dosages as well. And again, as we mentioned before, different brands contain different amounts of glucosamine. So always read the label and compare the different brands, and ask your pharmacist for some help as well around comparing the brands. So the next one we're going to touch on is chondroitin, and this is another supplement that's usually often recommended alongside glucosamine. It's found naturally in the body and is a vital part of joint cartilage. So often a lot of the research, there has been research that sort of looked at chondroitin by itself, as well as in conjunction with glucosamine. So the claims around its effectiveness in research have either come from, its usage alone or in combination. It's very similar to glucosamine. Newer research suggests that the prior research behind many of these claims for its effectiveness tend to be low quality. So to date, there's no high quality evidence that these supplements are effective for any forms of arthritis. However, as we sort of mentioned with glucosamine, it's generally considered safe. And again, side effects are quite mild. Similar to glucosamine, there is the increased risk of bleeding, which is quite similar to a lot of the different therapies that we'll touch on in this presentation. It also, for people with asthma, can make breathing problems worse. So if you fall into any of these groups, always make sure you seek medical advice before taking any of these supplements. Thought I might just, we've sort of gone through, I guess, a little bit of information. So what we might do is just sort of take a little pause, and if there are sort of any questions at this stage, if you do want to pop them in. If you don't have any questions to pop in the chat box, we can keep going on and then have a little bit of a chat and questions when we get to the end as well. No questions yet? All good to continue on? Yes, we will certainly send around the recording to everybody that's registered for today's presentation. Thank you. So next to touch on is turmeric. So turmeric is I think a spice that a lot of people are familiar with. It's used commonly in cooking. It has a warm, bitter taste and is frequently used to flavour or colour curry powders, mustards, and cheeses. And it's believed that turmeric, and particularly a chemical that it contains called curcumin, that they have anti-inflammatory properties. Turmeric has been researched for its effects on osteoarthritis. However, findings are limited, and at this stage, the certainty around effectiveness is not quite clear. So like some of the other supplements that we have mentioned, turmeric and curcumin seem to be generally well tolerated. And again, most common side effects observed in clinical studies that have occurred are around gastrointestinal effects. So again, constipation and diarrhea, reflux, nausea and vomiting. And as we've sort of discussed with some of the others, caution is advised for those who take medications like warfarin. And with turmeric as well, large doses potentially can also increase risk of kidney stone formation. Rosehip, another herb that is sometimes suggested or recommended for arthritis. So rosehip comes from a species of wild rose and is extracted from the fruit that develops after the flower of the plant has died. So where its interest for arthritis comes from, so it contains compounds that may help relieve joint inflammation, such as polyphenols and anthocyanins. And along with this, it also contains vitamin C, which is an antioxidant. But sort of for vitamin C specifically, it hasn't been confirmed if this will give any added benefits in arthritis, but there is potential that it may play some role. So rosehip again is available in different forms, generally as capsules and a powder. So the effectiveness of rosehip specifically for osteoarthritis come from a few different sort of trials. So a randomized controlled trial, which is generally one of the best standards for research trials, show that people, after 15 weeks of treatment, patients on rosehip had significantly reduced pain, stiffness, disability, and consumption of painkillers, plus a significant improvement in overall disease severity compared to patients on a placebo. Also for rheumatoid arthritis, another study showed that people with rheumatoid arthritis took rosehip powder daily for 6 months, and this resulted in improvements in disease activity, quality of life, and physical function. So overall, there is some moderate evidence that rosehip may have some benefits in symptoms of osteoarthritis. The evidence surrounding its use in rheumatoid arthritis is less clear, but there is some limited evidence that does show it may have some benefit. For specific dosages, so unfortunately the dosage for rosehip has not been well studied. Generally, the studies that have looked at rosehip have used an amount of 5 grams daily, but it is recommended to speak with your GP regarding the correct dose for you as well. Rosehip is generally considered safe as well. Again, it can have mild gastrointestinal side effects, and interactions with other medications haven't been well studied. So again, where it's important to have a chat with your GP and depending on what other medications you may be taking, and the advice of your GP is really important to take. So this one I always find quite difficult to pronounce. So capsaicin. So it is a component of chili peppers and it's extracted from plant tissues. It affects by using what's called substance P, which plays a role in the transmission of pain signals from nerves to the brain. So it's been studied for its effects in osteoarthritis and in fibromyalgia, and it generally is used in a form of a gel or a cream that's applied to either the affected joint in osteoarthritis or in fibromyalgia, the affected area. So results have shown that in osteoarthritis, there is some evidence that it may help to reduce pain and tenderness in affected joints. Unfortunately, the research for its effects in fibromyalgia is still quite limited, so it's a little bit unclear at this stage on what or if it has any significant effects in fibromyalgia. In terms of dosage, a lot of the trials have either used extremely small, so 0.025% or 0.075% of capsaicin gel applied to the skin 4 times a day. So the product is available often by prescription, but it can also be found in some over-the-counter gels or creams. But again, it's recommended, as always, to talk with your GP about suitability if you're thinking of trying it before getting started. Overall, it's generally considered safe. At this stage, there's been no reported drug interactions. Some people may experience a slight burning sensation and brief redness, which can be common when the gel is applied to the skin. So that's sort of some of the more, I guess, specific ones that we'll go through and sort of the different research available. There is, of course, many other complementary treatments that you may have heard mentioned for arthritis. We've mentioned just a couple here, so cat's claw, devil's claw, or ginger, which are all extracted from certain plant roots. Overall, I guess the key takeaway here is that there are, and similar to a lot of different complementary therapies, there are small amounts of research that have been undertaken, which may sometimes show some benefits for different types of arthritis. But generally, the research that has been completed is in small amounts, And sometimes it's also inconclusive or inconsistent evidence for its effectiveness. So sometimes one study might show that there is some small benefits, and then another study shows that it really doesn't make much difference when compared to placebos. Well, ginger, it tends to be generally well tolerated. More research is definitely needed for cat's claw and devil's claw, and there have been some serious side effects that have been reported in some studies. So again, really important to speak with your healthcare team whenever starting anything new, so they can consider your situation and any of the health conditions or medications that you may take to know if it's safe for you to try. So there can always be sort of various different treatments that, although they may not show much benefit for arthritis, if they are generally safe and your health team consider them safe for you, sometimes it might be worth giving them a go and seeing if they do help, and if they do have any benefit, that's really great. But it's always making sure that you have checked and made sure that they are safe and suitable for you first. So cat claw, as we've mentioned, cat claw and devil claw, and ginger, they may also, like some other conditions, increase risk of bleeding. The other concern is there's not enough studies to suggest any of them are effective at reducing arthritis symptoms, and there is some research around their side effects and various safety precautions. Some other types of complementary treatments which you may have tried previously. So various different sort of analgesic creams are available on the market, and sometimes they are recommended to help with managing arthritis symptoms. The main thing is they tend to be sort of short term. It can be really helpful to, if they are effective, to provide some short term pain relief. But of course, it sort of does wear off over time as well. So we've got two examples mentioned here. There are many on the market available. So we've got Physiocrem and Voltaren. Just a couple of differences between them. So for Physiocrem, it contains natural ingredients that stop the inflammation process quite quick. So it tends to be quite popular among athletes because of its fast joint pain relief. It can be used for muscle pain, but it is also suitable for joints. And the smell of the Physiocrem tends to have a better odor than Voltaren. Some people have suggested as well, so not quite strong of a smell. As it works more quickly, it is more potent, so it can tend to cost more to buy. Also worth noting that it can be quite painful if applied to broken skin, as it is a strong cream. So always read the label and use as directed. Voltaren, it tends to be, because it's maybe not quite as potent, it can be a little bit cheaper out of the two, and it's also a very well-known brand. It does need to be, it needs a firmer massage compared to Physiocrem because it is that little bit weaker. And as we mentioned, it has a strong odor that some people tend to comment on as well. And because it's not quite as potent, it can take a little longer to target pain in joints. So I guess sort of summarising sort of some of the things that we have been through. So some food for thought around complementary and alternative medicines. So really the key concerns for doctors and members of your health team tend to be around the prescription and education of complementary medicines, because of that there's a lack of reliable information. And there's also issues around regulation of complementary therapies and their prescription. So often health professionals may not feel quite confident to deal with questions from people around complementary medicines, their use and their effectiveness. And they tend to be quite cautious about recommending or discussing complementary therapies because of worries about how effective they are, their regulation, and how safe they are. In terms of the lack of regulation, so there are certainly health professionals that are regulated. So, for example, traditional Chinese medicine practitioners are regulated under the Australian Health Practitioner Regulation Agency. However, there are other health professionals that don't tend to have a professional regulation body, or it may not be a requirement. So there can be sort of differences around skills and knowledge and qualifications. And this tends to mean that, I guess, sort of there may be some therapists that are really excellent, but without sort of regulation, it's sort of, you may then sort of see another health profession, a complementary therapy professional, that it has the same sort of name, their health title is the same, but it's very different. Their standards can be quite different. So it is recommended to always check the qualifications of any therapist that you do see, and ensure that they are registered or have membership with a professional organisation. Another key problem with the use of complementary therapies is around the dose standardisation. So a lot of complementary therapies have not had, they don't have an established effective dose. And this is because the research that does exist for them can be quite limited. So there isn't sort of any consistent research that's been done on similar dosage amounts to be able to recommend this to patients. And there tends to be variation amongst different brands on doses that are recommended. So we sort of mentioned around how there's so many different brands of specific supplements, and they do vary by brand and even by the form as well. So whether it comes as a tablet form or an oil or a powder. So the other issue that we have with complementary therapies is they tend to include a variety of botanicals and nutritional products, so such as herbal and dietary supplements and vitamins. So not all products have been approved by the Food and Drug Administration or the Therapeutic Goods Administration before they are sold to the public. And you also don't need a prescription to buy them. So it's really up to you to ensure that what you are considering trialing, you have sort of really considered what's in it and what the benefits may be, as well as having a chat with your health team around the safety as well for you. So the other issue that we've noted here is also around sometimes it can delay effective mainstream therapy. So sometimes some people may rely on complementary or alternative medicines and as an alternative to conventional medicines. And this can mean delaying the start of a medical treatment, or in some cases, they may stop taking a medical treatment to move towards complementary therapies as well. But in general, complementary therapies can be effective if used alongside conventional treatments as well, hence the term complementary. Again, we've sort of touched on as well, is really around the long-term effects of complementary medicine. So we sort of mentioned there's limited research around, in general, the safety, and this also goes for sort of long-term usage as well. So there's still a lot of research that does need to be done on various different supplements and therapies to really know what the long-term safety is of using them. So if you are thinking of starting a new supplement or looking into a different therapy, I guess what can you do, or what's important to consider? So it's really important to understand whether the benefits have been clearly proven so that you're not misled or given false hope. So it's worth doing a little bit of research and reading and having a chat with your health team. And if you are sort of thinking of trying a therapy and you sort of know that it's maybe been researched a little bit and the effects are inconclusive, but it is generally safe. Like I mentioned, it might be something that you do give a go, but it's at least sort of going into that, knowing what to expect, and that it's not sort of, I guess, putting false hope on the product, that it will sort of be a really effective cure or treatment, and then being disappointed if it doesn't really provide any benefit at all. So it's really important to openly discuss anything that you're considering trying with your GP or specialist or pharmacist before starting. So they may be able to provide you with more information around the evidence for their use and how effective they are. But also the really key thing is around the safety, and because there is so many different treatments available and everybody's situation is different, having someone that is part of your medical team that knows your situation and can look at the research around the safety for different health conditions and different medications and provide you with that sort of specific individual advice is really important. They'll also be able to help you with information around the dosage as well, and for those specific variances in different brands. You may, and it may be something that you have tried doing before and sort of found that your maybe your doctor or a member of your health team sort of maybe seem like they disapproved of trialing different therapies, and it might make you reluctant to sort of want to discuss that with them. But overall, it is really important to keep them informed because they can't provide you with the best professional advice if they're not aware of all the treatments that you're using. So as we've seen throughout this presentation, there are sort of different medications that can have interactions with different supplements or treatments. So it's really important that the members of your health team are aware of anything that you are taking, just in case there is any of those precautions. I've also got a note here as well around just touching briefly on sort of nutrient deficiencies or vitamin and mineral deficiencies, which sometimes can be a reason why people might use supplementation. And that is completely fine as well. It is recommended and worth speaking with a dietitian if you are sort of deficient in a particular mineral or vitamin, so they can work with you to make sure that you're also getting those nutrients from your diet. So when we sort of look at supplementation versus getting things via food, of course, when we get vitamins and nutrients in foods, it's not just a single vitamin or nutrient that we get. There's so many sort of different components in those foods, which can affect the way our body absorbs them. So sometimes there's certain ways we can get it in our diet which can be really well absorbed and really well tolerated, but for some people, depending on their health status and different conditions, they may need supplementation for different vitamins and minerals and nutrients. But it's worth having a check-in with a dietitian who can provide that advice around diet as well as supplements that may be helpful in the dosages that you do need of those. And one thing I actually don't think I have mentioned as well is something that often people tend to gravitate towards complementary medicines for as well, is because they can be natural and come from natural sources. And people feel like it may be a healthier alternative or safer alternative because they are natural. So it is worth mentioning that because they are natural products, it doesn't always mean that they are good for you. And it's because with complementary therapies, and we've sort of looked at how they've been specifically studied for different types of arthritis, they're often sort of extracted and used in more concentrated forms than what we would naturally get within our diet as well. So we can sort of have too much sometimes, which can cause issues around safety and toxicity, and also how they interact with other medications or specific conditions. So it's important to remember that natural doesn't always mean that it is safe and suitable. And then just finally, I guess everyone's experience of arthritis is different, which can make it quite difficult when it comes to finding treatments that do help to give relief from pain and different arthritis symptoms. So it does mean that while something might work well for someone, it doesn't necessarily mean it does work well for everybody. Like we've sort of discussed through this, it's worth sort of having a look at the research that has been done on different therapies, and sometimes that we do find they have had some benefit in some groups, and it may be worth trying. But unfortunately, it doesn't always mean that for everyone it will have benefit and it will be helpful. So just finally, some different sources of information. It's always important, I think we all know, to be careful of what we do read on the internet or even hearing from family and friends. And while many people can be well-intentioned with making suggestions for different supplements and different things to try, unfortunately, they're not always experts, and so we do need to take caution with the advice that we do get from well-meaning friends and family, and that we do read online. Some different sources. There is a medicines line phone number that you can get in touch with to have a chat if you are sort of looking for more information around different medicines and different supplements and therapies. Like we mentioned, always having a talk to members of your health team, particularly if there is someone in your health team that you feel is quite, does listen to your concerns and sort of considers the different things that you might suggest and ask them as well, and getting that advice from someone that is registered with a professional association. And then just a couple of web links that we have included there as well. So in terms of timing, we've gone pretty good. We've got about 10 minutes left, which is a really good amount of time for if anyone has some questions. So I just saw there was a question from earlier around rosehip. Does it come in tablets and powder, and what is the best form? So it does come in different forms. My understanding from having a little read around some of the research that has been done, there hasn't been a particular form recommended over another, and it's more around the dosage. So the amounts can differ between the tablets and the powder. So it's just making sure that we talk with a pharmacist and read the information on the label to make sure whichever dosage that we are taking is right for that form, to make sure that there is enough in it for the benefits to work to sort of be in line with what the research has been done. So yeah, not necessarily one better than the other. Was there any other questions at all that anyone wanted to pop in the chat?
Can I ask, not in the chat at the moment,
Yeah.
I suffer from reflux and
Okay.
medication for this, and look, it comes and goes. I might be 3 months free of it, but I also take turmeric for my.
Yeah.
You mentioned that reflux can be aggravated by that, or what's the incidence?
Yeah, the incidence, I'm not sure off the top of my head. I guess it's sort of in the research that has been done. So the research will tend to sort of, obviously they do want to know, particularly when they're looking around safety and side effects as well, they'll sort of look at the different types of symptoms that people commonly report, as well as maybe the less reported ones. So I'm not certain on the incidence, but it is a more common side effect that has been reported in some of the studies around the reflux and some of those other gastrointestinal symptoms as well. It sounds like you're already taking it, and potentially it hasn't maybe had those symptoms in you. But like mentioned, it is worth having if it is something that you are concerned about, have a chat with your GP and just mention it. But they may be quite okay if it's sort of something that you already have been taking and haven't reported those symptoms as well.
Yes. Thank you. That's great.
Yeah.
Yeah, hi. I just have it may sound like a silly question, but the lady's talking about rosehip. I mean, rosehip tea is very popular. I mean, is there any benefit